Starting our first session of the skeletal system, the anatomy part of the skeletal system. This is the main part of the upcoming lab exam. So in the upcoming lab exam, you're gonna be checking out a set of bones as well as bone markings that you're gonna need to be able to identify. And this is what we're gonna be discussing over the next two sessions. All right, so starting first, if you remember, we divided the skeleton into two main parts, the axial skeleton and the appendicular skeleton. The axial skeleton is going to be formed by the skull, the thoracic cage, and the vertebral column. You see on here, the vertebrae are going to be either located in the neck, and something related to the neck is called cervical. That will be also located in the chest, and if you remember, something related to the chest is going to be thoracic. So the vertebrae which are sharing in the formation of the chest, those are my thoracic vertebrae. And if you remember, the region between the thoracic cavity and the pelvis, this is called the lumbar region. So we call those vertebrae the lumbar vertebrae. Then we have the sacrum, and finally we have the coccyx. The thoracic cage is going to be formed by a central bone on here. This is called the sternum. And attached to the sternum as well as the thoracic vertebrae, we got the true ribs and the false ribs. Two of the false ribs on here are not going to be attached to the sternum. We call them floating ribs. So floating ribs are actually a type of false ribs. For the skull, we're going to see a set of bones. We call those are the cranial bones. And another set of bones that will share in the formation of the skull, those are my facial bones. Starting first with the skull. The skull has 8 cranial bones and 14 facial bones, and the main function of the skull will be to protect the brain as well as to provide a place for the other head and neck organs like your eyes, your tongue, your nasal cavity, sinuses, all those are parts, your ears, all those are going to be organs kept inside the skull. Starting first with the cranial bones. The cranial bones are going to be first the bone located in the anterior aspect of the head. Remember, the anterior aspect of the head here, something related to it is called frontal. So the first bones that we're looking at in here is the frontal bone. See on here. This is going to be my frontal bone. Forming the posterior aspect of the head, if you see on here, this is my occipital bone, occipital bone, occipital bone. So we've got frontal bone, occipital bone, and on both sides, connecting the frontal to the occipital bones, we've got the two parietal bones, parietal bones, parietal bones, and down here, just above your ears, connected superiorly to the parietal bone and posteriorly to the occipital bone. We've got here is by temporal bone. Temporal bone. So what is temporary means? Temporary means what? If I told you this is something temporary, what this means? Not permanent, right? Not something permanent. It's for a short duration. So what is temporal? Temporal means time, time. So why do we call this part the time bone? Why do we call this bone the time bone, temporal bone? What do you think? Any guesses? Why did they call it the temporal bone or the time bone? This is my temporal bone on here. Temporal bone. Right. This is the first site where people get their first white or gray hair. So it gives you an idea about the time or the age of a person. All right, so they call this part on here, this bone is my temporal bone because it gives us an idea about the age or the time. All right. So again, what are those cranial bones? Try to stay active for you to not spend a lot of time memorizing this on your own. We're here together. Try to memorize as much as you can while you're here. So what is this bone again? First cranial bones that you see. Try to respond as quickly as possible. All right, frontal bone, frontal bone. And the one in the posterior aspect of the head, posterior aspect of the skull is going to be formed by, what bone is this? Occipital bone, occipital bone. And on both sides on here, this one on here on the slide, this is my parietal bone, parietal bone. Underneath it here, the time bone here, we call it, this is my temporal bone, temporal bone, temporal bone. If I open the skull, so we'll hide the parietal bone. I will see this butterfly-shaped bone on the inside of the skull. You see on here, this butterfly-shaped bone, it has two small wings, you see? And two large wings. And connecting all the four of them, we've got the body here in the mid, and the body here. If you notice, if I'm looking from the side, it has an elevation, and then a depression, and then another elevation. This is what forms the body of my butterfly here. What do we call this bone that looks like a butterfly? It's my sphenoid bone. Sphenoid. 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 All right, so this is my sphenoid bone. Some people will pronounce it sphenoid. All right, so but some people will pronounce it sphenoid, but sphenoid bone. Right, both are acceptable. Sphenoid or sphenoid. All right, so again, what bone does look like a butterfly? It has, again, two small wings, two large wings, and connecting all those wings together. You see this body here, which is formed of elevation, depression, and another elevation. So what would we call those small wings of the sphenoid bone? Those are called my lesser wings. So if you see on here, those are my lesser wings. And from this view, those are my lesser wings. Can you guess what is the name here that we're gonna give to the large wings? If the small ones are lesser wings, what do you think is gonna be the name of the large wings? Greater wings, exactly. So what we're looking at in here, we're looking at the sphenoid bone. It has two small wings and two large wings. Two small wings, those are my lesser wings. Two large wings, those are my greater wings. And this body in the middle that has an elevation, depression, and another elevation, this is my Scylla Turcica. So if we're looking on here, this is my Scylla Turcica. Scylla Turcica is going to be formed of a tubercle, a hypophyseal fossa, this depression, and the posterior process. So what we need to know is just the name of the whole thing. You don't need to identify the smaller parts of the Scylla Turcica, but you need to remember the name of the whole thing on here. This is my Scylla Turcica. Scylla Turcica. So again, what we're looking at in here, we're looking at the sphenoid bone. It has two lesser wings, two greater wings, and this elevation, depression, and another elevation that will be as the body of a butterfly. This is my Scylla Turcica. Again, what do we call the whole bone? What do we call the whole bone? This is the whole bone all together, lesser wings, greater wings, and Scylla Turcica. This is my sphenoid bone. Sphenoid bone. Sphenoid bone. Any difficulty so far? Any difficulty? Another cranial bone that we can see here. Another cranial bone that we can see here. You'll see it. If you are moving forward, you see this is my frontal bone. And I am inside the cranial cavity. I will keep moving forward from the sphenoid bone. I will get in touch with the crest in an elevated ridge. This crest is actually part of another cranial bone called the ethmoid bone. Ethmoid bone. Ethmoid bone. So this is how the ethmoid bone looks like on the inside. All right, so it's crushed. All right, again, we're looking here at the ethmoid bone. Ethmoid bone. This is how it looks like inside the skull. So I will remove here the nasal cartilages. And the cartilage part that will share in the formation of the nasal septum. I will mark here. This is my ethmoid bone, and this is how it looks like in relation to the other cranial bones, you see? So I can see part of it bending down inside the nasal cavity. I can see part of it forming the medial wall of the orbit of the eye, if you notice on here. And I see part of it inside the cranial cavity. See part of it inside the cranial cavity. Again, what do we call this last cranial bone that we're looking at? It's my ethmoid bone. Ethmoid bone. So again, what is the name of this bone on here? That I can see part of it inside the cranial cavity. It's my ethmoid bone. Ethmoid bone. Ethmoid bone. All right, so looking at the different bone landmarks that we need to identify. For all those cranial bones, the first cranial bone that we looked at is the frontal bone. We need to identify two main markings for the frontal bone. If you touch your nose like this, and you kept moving up, you will feel an elevation just above your nose, between your eyebrows. This is called the glabella. This elevation just above your nose in your frontal bone, this is called the glabella. 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 Another markings that you can see on here in the frontal bone is this tiny little hole. This tiny little hole above the orbit. So we're gonna call it the foramen. Foramen means a hole located above the orbit. So we call it supra orbital, above the orbit, foramen. So we're looking here. This is my supra orbital foramen. So why between brackets we put a notch? Because in some people, it's not a complete hole like what you see on here. It's gonna be connected to the orbit. So rather than having something like this, an orbit, and above the orbit I have a hole, this is gonna be supraorbital foramen. I might have something that looks like this, an orbit, And rather than having a separate hole, I have a depression in the orbit like this. So it's a depression rather than a hole. So we call this is a notch. Can you imagine what I'm describing on here? So if they are connected together, like what you see here in number 1, it's gonna be a notch. So we call this is a supra-orbital notch. If it's not, they are not connected together, I have a hole above the orbit, so it's gonna be supra-orbital foramen. Supraorbital foramen. Supraorbital foramen. So again, what do we call this bone? The marked bone on the left side on here. This is my you have a delay in hearing me? Well, what do we call this bone again? It's my frontal bone. What do we call this elevation just above the nose? What do we call this elevation just above the nose? Glabella. Glabella, exactly. Glabella. What do we call the hole above the orbit? What do we call the hole above the orbit? Supra-orbital foramen or notch. Supra-orbital foramen or notch. It might be a notch, it might be a foramen. It might be a notch, it might be a foramen. All right, for the parietal bone, there is no important landmarks that we need to identify. No important landmarks. No important landmarks for the parietal bone. Moving on to the occipital bone. So let me remove. Looking here at the occipital bone, let me get another skull on here. So looking here at the occipital bone, what I would first notice in the occipital bone, first important landmarks that we have, is this elevated part in the dorsal aspect of the occipital bone. So if you touch the back of your head, you can feel that there is a elevation in the posterior aspect of the occipital bone, just above your neck, just above your neck. What do we call this large elevation protruding to the outside of the occipital bone? This is my external, because I'm on the outside, occipital, because I am part of the occipital bone, protuberance. So what we're looking at in here is this elevated part. What do we call this part on here in the occipital bone? It's my external occipital protuberance. External occipital external occipital protuberance. External occipital protuberance. It's protruding to the outside of the occipital bone. External occipital protuberance. External occipital protuberance. What other important marking we need to look at in here? It's gonna be this large hole. As you can see, this large hole at the base of the skull. This large hole at the base of the skull, if you are looking from outside, you'll see this large hole on here. This is my foramen magnum. Foramen magnum. Magnum means large. Foramen means a hole. So the large hole at the base of the skull, this is what we call the foramen magnum. Foramen magnum. On both sides of the foramen magnum, on the anterior side, you can see two elliptic-shaped articular surfaces. Two elliptic-shaped articular surfaces on both sides of the foramen magnum. We call this my occipital condyles. Condyles, those are articular surfaces. Condyle is an articular surface. And they are the articular surfaces of the occipital bone. So we call them occipital condyles. Occipital condyles. So what is the function of the foramen magnum? Foramen magnum is going to be the conduit that connects your brain to the spinal cord. It's going to be the conduit that connects your brain to the spinal cord. Occipital condyles, those are the articular surfaces that will allow the articulation between your head and your very first cervical vertebra on here, C1. So if you want to see the articulation between the occipital condyles and C1, see, this is my occipital condyle like this elliptic-shaped articular surface, and it articulates with the first vertebra, C1. All right, so occipital condyles will allow you to say yes. All right, so you say yes, you nod your head like this due to the articulation between the occipital condyles of your skull and the first cervical vertebra, or C1. Another name for C1 is atlas. Why do we call this? What do you think is the relation between the book that contains the maps? We call it also atlas, and this cervical vertebra. What do you think? Is there any relationship? Why both of them are called holding up the earth? Yes, exactly. So Atlas in Greek mythology is a god, and he is holding the earth on his back. So like the book that holds the maps, this is Atlas on here. Like the book, it holds the earth in the form of maps. That's why we call it Atlas. Here, the first cervical vertebra is holding your skull, up. All right, it looks like the Atlas, the god that holds the earth on his back. All right, so again, what is the function of the occipital condyles? They will allow the articulation between the skull and the atlas, or C1, or the first cervical vertebra. And this articulation between the occipital condyles and C1 allows you to say what? Yes. All right. Easy. So again, what are the important markings that we're looking here at in the occipital bone? We first looked at this protruding eminence in the back of the skull. This is my external occipital protuberance. External occipital protuberance. We've seen this large hole that will be connecting my brain to the spinal cord. This is my foramen magnum. Foramen magnum. And on both sides of the foramen magnum, we've got those elliptic shaped articular surfaces. What did we call them? Can you remind me, please? Occipital condyles. And what are the occipital condyles are articulating with? What are the occipital condyles articulate with? Atlas or C1. Atlas or C1. Also, you can see on here a ridge that will be connecting, as if it is connecting the external occipital protuberance to the foramen magnum. So a ridge is what we call a crest. A ridge on the bone is what we call the crest. So it's on the outside because we have another one on the inside. So we call it external. And it's located in the occipital bone. So we're gonna call it occipital. So what do we call this ridge that will be connecting the external occipital protuberance, the prominent eminence, to the foramen magnum? We call it the external occipital crest. External occipital crest. So again, what we're looking here at, we're looking at the external occipital protuberance, external occipital crest, foramen magnum, and here looking at the occipital condyles. Occipital condyles. All right, those are the most important markings that we need to identify in the occipital bone. One last important marking as well. Actually, we can't mark it on here. I want you to notice this hole. And tell me if you are looking at the skull from this side. Can you see this hole? Can you see it right now? How about when I tilt the skull down like this? Can you see a hole in here, a large irregular hole? Can you see this part, this hole from this view? See on here? You see it? You see it? Just what I want you to focus on here at this point. See this hole on here? I will keep moving, just focus with it. Don't lose it. All right, can you see it? You still can see it. You can see the inside of the skull through it. All right. But if you're looking from this view, can you still see it from this view? Can you still see it from this view? No. All right. What do we call this here? It's the jugular foramen. The jugular foramen. So actually, your diagram in the textbook is not highly accurate. It's not highly accurate. You can't actually see the jugular foramen from this view on the diagram, but they just added for you to not miss it. All right. So you can't see it from this view, but you need to tilt the skull a little for it to appear, because it's going to be located deeper to the occipital condyles. It's located deeper to the occipital condyle. What do we call again this foramen, this hole that is located deeper to the occipital condyle? You can see it when you tilt the skull like this on here. This is my jugular foramen. Jugular foramen. Jugular foramen. All right. Jugular foramen. Questions? 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 So again, what did we discuss so far? We discussed the frontal bone. We've seen the glabella and the supraorbital foramen. We've seen the parietal bone, and we stated that we don't need to know any specific marking on the parietal bone. Then we discussed the occipital bone. And for the first set of in-class activities for today, please name those markings. Please name the bone landmarks. This is part of the in-class activity. This is part of the in-class activity. All right, we're gonna get to Theodore. We're gonna get to the carotid canal in a second. We're gonna get to the carotid canal in a second. All right, please answer those 4 questions as part of your in-class activity for today. So what did we call number 1 again? My external occipital protuberance. What do we call number 2? What do we call number 2 here? It's my external occipital crest. Number 3 is my foramen magnum. And number 4, those are my occipital condyles. The position of the foramen, of the jugular foramen, external occipital crest. So the position of the jugular foramen, see on here. So anybody needs those questions? Anybody still needs those questions? Anybody still needs those questions? All right. So all good, because I need to remove them to move the skull around. All right, so we're looking here. This is my occipital condyle. It's deeper to it, means it's covered by the occipital condyle. It's a large and irregular. When we compare it to other foramens, like for example here, the carotid canal, you see it's circular and it has a depth. And it's not actually part of the occipital bone. It is part of another bone, which is the temporal bone. See, jugular foramen is a large, irregular foramen that is located between the occipital bone and the temporal bone. This is my jugular foramen on here. All right, this is my jugular foramen. So this is my occipital condyle. You'll see it's underneath. It's at a level lower than the occipital condyle, or actually above, because we're looking from underneath. All right, so this is going to be my jugular foramen, and this is going to be the site for the conduction of vessels out to the outside of the brain, of the cranial cavity, to be conducted to the heart. Again, what do we call this foramen on here again? This is my jugular foramen, jugular foramen. Questions? All right, so moving on to another cranial bone. This is gonna be my what bone? Can you remind me what did we call this bone on here on the side? Can you remind me what do we call this bone on the side? Where you get the first white hair, first gray hair? It's my temporal bone. Temporal bone. If you notice on here, is the temporal bone has a process that will be connecting it to the bone of the cheek. What do we call the bone of the cheek? It's the zygomatic bone. See here, this is the bone of the cheek. This is my zygomatic bone. Zygomatic bone. Zygomatic bone. This is my zygomatic bone. We are studying right now the temporal bone, and you will see a bony process that will be attaching the temporal bone to the zygomatic bone. So we call this process that connects the temporal bone to the zygomatic bone is my zygomatic process. It's my zygomatic process. Zygomatic process. What is the zygomatic process? It's the bony process that will be connecting the temporal bone to my zygomatic bone, as you see on here. This is my zygomatic process. Zygomatic process. Other processes that we can see on here, if you are touching just behind your ears, you will feel a bony eminence just behind your ears, a bony eminence, which is thick, large, and in the same time, it's blunt, it's not pointed. We call this is the mastoid process. Mastoid process. Mastoid process. This is my mastoid process on here. Mastoid process. And just anterior to it, you've got a pointed, thin, long process. Pointed, thin, long process that is located anterior and medial to the mastoid process. You can't touch it. It's on the inside. This is called the styloid process. Styloid process. So remember, which one is mastoid, which one is styloid? The one that is thin, long, and pointed. This is going to be the styloid process. The thick, large process, this is my mastoid process. A way to not get them confused. So how people think that a person is stylish, looks stylish, things, most of the people think so when a person is thin, long, and sharp. All right, thin, long, and sharp, it's style. A person is stylish. So remember the one that is thin, long, and pointed. Sharp here is going to be the stylish, or we say styloid process. Styloid process. So again, which one is mastoid? Which one is styloid? Right, number 5 for in-class activity for today. Number 6. What did you get for number 5? What did you get for number 5? Is this a styloid or mastoid? Which one is styloid? 5 or 6? Styloid. Styloid. 5. And which one is mastoid? Mastoid is going to be number 6. So again, those are questions number 5 and 6 for today's in-class activity. So please add those to your assignment. All right, so again, thin, long, and pointed. This is my styloid. Large, short, and broad. This is going to be mastoid. How about the process that connects? Can you remind me the temporal bone to the zygomatic bone? What did we call this process? This process that connects the temporal bone to the zygomatic bone, the bone of the cheek. This is my zygomatic process. So please add this also to your in-class activity for today, number 7. Zygomatic process. Zygomatic process. So in the temporal bone, we need to identify 3 processes: zygomatic process, mastoid process, and styloid process. Any difficulties so far? Any questions? Any questions? Another important marking that we can see on here. Yeah, it takes time and it takes practice. There is no way you can study this overnight. You have 2 weeks until your exam is due. All right, so you need to start from today preparing for the exam in 2 weeks. All right, it's very, very important. You need to spend enough time. And you keep repeating, as this is what I'm trying to do with you here. All right, I'm trying to repeat the information more than once for you to be able to recall as much as you can from the class. And the best time to study this material is today. If you waited until tomorrow, most of the information you're getting right now will be gone. All right. Yes, definitely you should remember the names. So while we're learning them. Yes, as scheduled. All right. This course needs a lot of memorization and needs you to be able to understand. All right. The more you grasp the concepts, the less you memorize. All right. So as I have sent you, as I've told you before, concerning the recordings, I have sent you the YouTube channels that I'm using to upload. I will send it out in the chatting box at the end of class today. All right, for those who want to access the recordings. All right, so again, What bone? What bone are we looking at? What bone are we looking at in here? What's the name of the whole bone? It's my temporal bone. 3 processes that we've seen. The large one is going to be mastoid, thin pointed, long styloid. The one that connects the temporal bone to the zygomatic bone, it's my zygomatic process. I have the canal that would be connecting the external ear to the middle ear. External ear, this ear pinna that you have on the outside, the cartilage part. It was, what kind of cartilage? Can you remind me? What kind of cartilage did you have in your external ear, your ear pinna? What kind of cartilage did you have in the external ear? Elastic cartilage, exactly. Elastic cartilage. All right, so this funnel-shaped elastic cartilage that will be collecting the sound waves, going to be conducting those sound waves down through this canal. This is called the external auditory or acoustic meatus. See on here, this hole, it's my external on the outside. Auditory or acoustic. Auditory means hearing, or acoustic means sound. So it's external auditory means the hearing, meatus, the opening on here. So external auditory meatus, or in your textbook also another name that is stated is external acoustic meatus. Acoustic means sound, auditory means to hear. All right, so external auditory meatus. Those are pretty much most of the landmarks that we need to identify in the temporal bone. So again, what bone are we looking at in here? It's my temporal bone. We've seen the zygomatic process, mastoid process, styloid process, and external auditory meatus or acoustic meatus. All right, so if we flip to the other side, if we're looking at the base of the skull from outside, I'm still looking at important markings on the temporal bone. What can you see on here? I see a rounded tunnel. A rounded tunnel. It's part of which bone again? It's part of my temporal bone. What do we call this rounded tunnel? It's the tunnel through which an important arch is going to be traveling. So we're going to name it according to the name of the artery. We call this is my carotid canal. Carotid canal. So again, what do we call this rounded tunnel through which the artery going to be traveling to reach the brain? This is my carotid canal. Carotid canal. Carotid canal. So again, what did we mention so far? Seen the frontal bone. We've seen the glabella. We've seen the external, the supraorbital foramen. Supraorbital foramen. In the occipital bone, we've seen the external occipital protuberance, external occipital crest, and occipital condyles, as well as this large hole at the base of the skull that connects the brain to the spinal cord. This is my foramen magnum. Foramen magnum. Foramen magnum. If we're looking on here, seeing a large irregular foramen, located between the occipital bone and the temporal bone. This is my jugular foramen. For the temporal bone, what parts that we need to identify? We need to identify this process. So on the test, a tricky question. So if I ask you here to identify the bone, and I'm marking this, identify the bone. And this is what I'm pointing to. Identify the bone. What is your answer that you're going to be looking for this question? Zygomatic process. Any other ideas? Any other ideas? Any other ideas? So identify the bone. What's the name of the bone? It's not zygomatic process. It's the temporal bone. Zygomatic process is part of the temporal bone. All right, so if I'm asking about the name of the bone, I want you to give me a name of a bone, not the name of the bone landmark. So if I wanted you to state here, so here, if I am asking about identifying the bone, it's going to be temporal bone. It's my temporal bone. I'm marking the zygomatic process. If the question is asking you to identify the bone landmark, if I'm asking you to identify the bone landmark, at this point you're going to tell me it's the zygomatic process. All right, did you get this? So when I'm asking, if I'm asking about the name of the bone, please mention the name of the bone, the name of the actual bone, not the bone landmark, the bone part. Is this clear? Is this clear? It's the same concept on here. So you might have one marking like this. I'm asking you to identify the name of the bone. What is the name of the bone? Occipital bone. If I'm asking this on the same marking, I'm using the same exact marking. I'm just asking here, what is the name of the bone landmark? What's the name of the bone landmark? External occipital protuberance. External occipital protuberance. All right, all right. Moving on to this bone on here. What did we call this butterfly-shaped bone? Look, is that we can see on the inside of the skull. Also, the greater wings appear on the lateral aspect, connecting the occipital to the parietal and the temporal bone together. This is going to be my sphenoid bone, exactly. And remember, sphenoid bone has how many wings? I have 2 lesser wings and 2 greater wings. 2 lesser wings, 2 greater wings. So 4. Yes. And you see on here, this body of the butterfly, what we're call this elevation, depression, and elevation. Altogether, it's my Scylla Turcica. Scylla Turcica. What is the importance, clinical importance of the Scylla Turcica? This is the pouch that holds a gland pending down from the brain, called the pituitary gland. So the pituitary gland is pending down like this. Inside this depression of my Scylla Turcica. All right, so again, what is the function of the Scylla Turcica? It holds a gland pending down from the brain. This is my pituitary gland. If we're looking here to our last cranial bone, this is my ethmoid bone. What are the important markings? So you see on here, this is how the ethmoid bone looks like when articulated with the other cranial and facial bones. So this is how it looks like when you separate all the rest of the cranial and facial bones. So if you want here, looking closer, you're going to see a ridge, an elevated ridge. We call this ridge, it's my crista galli. Crista galli is the point of attachment of the brain to the skull. So this is the point where the brain is holding itself to the skull. Because this is again my crista galli. Crista galli. On both sides of the crista galli, we've got those plates, bony plates, and they are perforated. So you see those very small holes. Those very small holes in the plates, we call those are my cribriform plates. Cribriform plates. So if we're looking on here, this is a part of the ethmoid bone that we're looking at. I see this elevated ridge on here. This is my crista galli. And on both sides of the crista galli, we'll see those plates. On here, those perforated plates, those are my cribriform plates. Cribriform plates. And again, all those are part of my what bone? Of my ethmoid bone. Ethmoid bone. Other parts that you can see here of the ethmoid bone is going to appear on the inside of my nasal cavity. I have here this part bending down inside the nasal cavity is on here. This is called the perpendicular plate. Perpendicular plate. Perpendicular plate. It's going to be sharing in the formation of the nasal septum that splits the nasal cavity into a right and a left space. All right, so what do we call here is this plate that descends in the midline of the nasal cavity. This is my perpendicular plate. Perpendicular plate. Also, you can see those elevations on the sides. Those are my middle nasal conchae. Middle nasal conchae, those are going to be elevations located inside the nasal cavity that will allow you to slow down the air that you're breathing and humidify and warm it. All right, so those elevations are covered with mucous membranes to humidify, to warm the inhaled air. All right, so again, what we're looking at in here, we're looking at the inside of the cranial cavity. We did see the sphenoid bone with 2 lesser wings, 2 greater wings, and Scylla Turcica. Anterior to this, we've seen a crest, and on both sides of the crest, we've seen perforated plates. All this is going to be part of my ethmoid bone. Seen another part of the ethmoid bone down in here. Inside the nasal cavity. This is called my perpendicular plate. Perpendicular plate. And on the side here, those elevated ridges on the sides of the nasal cavity, those gonna be my middle nasal conchae, which will be again part of the ethmoid bone. Ethmoid bone. So what do you think is going to be the way by which we're going to be dealing with a pituitary gland tumor? So if a person has an enlarged pituitary gland located in the Scylla Turcica of the sphenoid bone, how can we remove this tumor if it's not shrinking with medications? How do you think we're going to deal with this tumor? How can we remove it? Through the nose, through the nasal cavity. See on here how we're going to be passing to the inside of the nasal cavity with the endoscope, and we're going to be breaking down the roof here, which is going to be the cribriform plates. So you're going to be breaking down the cribriform plates of the S or one side, on one side. And that's why people after the surgery will want to have normal smell sensation, because the cribriform plates is going to be the pathway of the nerve fibers carrying the smell sensation from the mucosa of the nasal cavity to the olfactory bulb that will conduct the smell signals to the brain. So I break down the cribriform plates. I'm passing to the inside of the cranial cavity, moving backward until I reach the Scylla Turcica of the sphenoid bone. I have good access to the enlarged pituitary gland. So what will I do with the endoscope? Suction, and you cut it to be removed from the cranial cavity. And you pull it out again through the nose. Questions? 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 Any questions? All right, so we can have a 10 minutes break, and we're gonna be back to complete our discussion of the axial skeleton, and we're gonna start today also part of the appendicular skeleton if we got time. All right, so we have 10 minutes break. Any questions before we move for a break? All right, we'll see you in 10.